So welcome back, ladies and gentlemen, to the TCM community, and today I'm joined by Yunike Budiono, who is has a bachelor in medicine, and she's an MD, and she's doing research, a master's thesis for healthcare policy, innovation, and management at the University of Maastricht. Correct?
Yeah, correct.
Okay. And you were specifically doing research into the effectiveness of acupuncture, right?
Yeah.
Okay, how did that come about? And what is this research about?
Okay, first of all, thank you for your opportunity to visit your practice. I'm so grateful to be in your practice and see how is your work for the acupuncture.
You're welcome.
I'm wondering how this acupuncture treatment affects this low back pain patient. So I want to see how satisfied are they to have this treatment, because the low back pain is very, very common cases in this Netherlands. And I've also read that this low back pain mostly in the south area of the Netherlands, mostly in Limburg area. And yeah, for their onset, they also have the recurrent situation even after 1 year of onset, so they keep coming back. And this is very common. So I would like to know, are they still willing to have this acupuncture treatment or not?
Okay, even after. Okay,
yeah, even after.
This is very important because, of course, we need more scientific study and more cases to prove the effectiveness of acupuncture. And by the way, you're only focusing on, for this study, on acupuncture, right? So no combinations with Tuina or herbal medicine.
For now, no, yeah, just the acupuncture treatment. But the acupuncture method itself, it depends on the acupuncturist. So you can perform any of the methods as long as it's acupuncture.
So tan balance method is welcome. Master bone points, classical acupuncture, electroacupuncture.
Yeah. Okay. But you can combine with
not combine with Tuina or herbal medicine.
Yes.
Okay.
The survey is very easy. So this is online survey. I make it because people here now high technology.
Yeah.
So you just scan or follow the link.
And so the because you reached out to the professional association Zhong, right?
It's Zhong, yes.
And then so the acupuncturists, I believe this email went out to all these acupuncturists, and I think it's easier, like if they print this out, they hang it in the form in their clinic, like here.
You can multiply this, print it out.
And so all the patient has to do is, if they're willing to participate, scan.
Yes. If they are can fill this all criteria, and they're in English, because all of the surveys, the questions is in English.
All right.
And then they are adults above 18 years old. And then they have the low back pain right now, and then they have the difficulties. It's not just the heavy difficulties, but just walk few meters and also just bend over. That also can do, as long as they have like difficulties on or uncomfortable with doing something. Then they are welcome. And also they, of course, want to have the acupuncture treatment in your practice, and they are willing to give the feedback on this.
So it's about feedback, and not just complicated sciatica cases, but also just lower back complaints, like sudden, you're working in your garden and then something happens, and then you say acupuncturist. Okay.
So it can be acute or chronic. It's okay. They are welcome.
But the best reaction would be if they are new patients.
It could be
like acupuncture
patients
for the first time.
So I need to know. I need to compare their pain score and how satisfied they are, and before they have the acupuncture treatment. And then I will distribute the second survey in 6 weeks after they fill out the first survey. And I will ask them like how many treatments that they had, and also the duration of each treatment. And I have to compare if the pain level is different than the first one before they coming over to have their treatment. Yeah. So that can be very different score in those two surveys.
Yeah, and then so the first and the second survey, they both have scales where you can score the pain.
The main questions are the same. The difference just the demographic data. At the first questionnaires, I will ask about their age, their genders, their occupation. So it might be different because if you're working in the office or you are lifting heavy stuff and such, so you can complain like different side, different pain experience.
Yeah.
And for the second survey, I will just ask how many treatments that they have in these 6 weeks and just the duration.
So on average, how many questions do the surveys have?
The question around 30 questions, I think. And I also, the first page, I have to ask their consent to follow this.
Of course, yeah.
It's in the board of survey, so they can also think about joining in the survey.
Okay, well, thank you for explaining this to us. I hope you have a lot of participants and a lot of patients that are willing to participate in the survey. But we're trying to help because this is really the scientific backing that.
I hope that the result will also help you to discover these new things and how effective this acupuncture treatment.
Of course, I know how effective it is, but we have to let people know and see how effective it can be.
Yeah. So that hopefully I will share this to more broader scale.
But I guess if you have interesting results, you could share them with the association.
With the
for example, and then they can share it with their members and they can relay it to the patients, for example. Yeah, you heard it, ladies and gentlemen. Please check out the survey. I'm gonna put the link in the description down below.
Please, thank you.
For the other acupuncturists, and thanks for being here. And maybe we'll see you again next time.
See you. Thank you.
Okay.
Bye.